The big change in the last 5 to 10 years is that providers and payers are investing heavily on systems that measure and analyze clinical performance, what treatments, what services are provided to patients, and what outcomes those generate. And I think the big change there, as in most things in healthcare, is the financial incentives. I mean, healthcare is a follow the money industry. And the big change is that both coming from the private payer community and coming from the government, financial incentives in terms of how providers get paid have been put in place that have created this reason to invest in clinical systems and in data analytics and other tools to monitor and measure performance.
Just the sort of the level of sophistication that I think the folks that we work with in terms of how to power things, I think there's pretty rapidly going from this notion of, hey, retrospective reporting is great, and you're starting to see some real innovation in terms of both predictive and prescriptive type things. So I do feel like one is there's just the underlying infrastructure that you need to power some of the analytics that I think are really going to make a difference in the industry are there, and you're starting to see an increased level of sophistication and folks moving from other parts of the economy into healthcare. I think a lot of the small companies that we see, you're starting to see folks that have come from financial services who've kind of seen this happen in other industries and trying to get involved.
So the stimulus basically said, here's some vouchers. Docs and hospitals, here's a voucher for you. You can get $44,000 to cover the costs of the systems if you buy a certified electronic health record, certified by the government, that was my office, and use it in these certain ways. It's not just buying the thing, and you actually have to play it, you know? So you have to order medications through the system. You have to document the diagnoses, the allergies, and so forth. And it's worked. But every year, for the past 4 years, we made as much progress, say, on the hospitals as we had in the 20 years before. That's pretty remarkable. And we're now up over half of hospitals can meet these requirements, which, you know, people were like, oh my God, how can you ask people to do this? This is impossible. No one's going to qualify for the payments. And it's really, really taken off. So on the medication ordering now, for example, we're now over 80% of hospitals, if you or someone you love is in the hospital, they're going to be ordering the medication through a computer, which can run checks and make sure that there's not an allergy, there's not a drug interaction, as opposed to handwriting it on a piece of paper and getting it transcribed 4 times. One small example.